First to speak will be Dr. Jeremy Hess. His topic will be international and national impacts of climate change on public health. Dr. Hess is an associate professor in the Departments of Emergency Medicine and Environmental and Occupational Health at Emory University Schools of Medicine and Public Health. His bio is there in the material that was handed out. I would hope that you all have a chance to read it, and rather than take up his time, I will let you take a look at that. Our second speaker will be Kim Knowlton. Dr. Knowlton will be speaking on the topic of national health impacts of climate change and what to expect in Ohio. Dr. Knowlton is Senior Scientist with the Health and Environmental Program at the Natural Resources Defense Council and leads the NRDC's Global Warming and Health Project. Again, her bio is there for you, and hopefully you'll take a look at that. We'll save the time for her to make her comments. And our third speaker is Mike McNutt. He will be speaking on the Cuyahoga County and Ohio health impacts of climate change and sustainability in public health. Mike McNutt is the watershed coordinator for the Tinkers Creek Watershed Partners. He's an employee of the Cuyahoga County Board of Health located in Cleveland, Ohio, and is involved in watershed management, the built environment, grant writing, sustainability programs, and public outreach efforts. Here is our first presenter, Dr. Jeremy Hess.
So I am coming from Atlanta, from the Centers for Disease Control and Prevention, to talk to you about something that we are very concerned about, which is the eventual health impacts of climate change, domestically and globally. And Representative Celeste talked this morning about the vanishing snows on top of Kilimanjaro, and I want to, by the end of the talk, have you get a sense of what the impacts are lower down on the people who live around the base of Mount Kilimanjaro in Africa, whose health burden is already quite significant and will be amplified considerably by climate change. I also want you to have some sense of what the health impacts are going to be domestically. I'm going to start there, and then we'll talk some about global health and what can be done next. I want to start out by asking you to think about where you're from. How many of you were born here in Ohio? Okay, roughly 2/3. Good. So probably those of you who have been living here for quite some time, so those of you who were born here, have some sense of how this place is already starting to change. You're starting to see some impacts from climate change. I want you to think about how those actually might be translated into impacts on human health. I'm going to help you think that through over the course of my presentation. And I want you to think about who's most at risk. Who's already most at risk here from diseases with environmental exposures. And what do we know about that? What do we need to know about that? And how do we go forward and protect public health for those populations? Now I'm coming to you from a place called the Piedmont, which is a geologic region that includes the base of the Appalachians and extends downward into the coastal plain of Georgia, North and South Carolina, and parts of Alabama. And it's a really lovely place. I love to garden, I love plants, and spring in that part of the world lasts about 4 months. Fall does too. It's really quite nice, and it's very healthy. Generally, I think we do a pretty good job of managing some of our most hazardous exposures. Unfortunately, we are, in Atlanta, along with LA, one of the poster children for sprawl. We're one of the poster children for urban air pollution. We obviously are part of our nickname, Hotlanta, makes us a poster child for heat. So we have a lot of risky exposures. You probably have heard about the drought we experienced over the last 2 years. It was what's called an exceptional drought. And lasted about 2 years, and in this year with what I consider to be exceptional rains. We've had really unusual amount of rain in the last year. Whether that's related to climate change or natural variability, people are still working out. But we do have some significant adverse exposures as a result of this. We have poor air quality during the summer. We had forest fires from the drought. We had traffic. We had endless road traffic injuries. I'm also practicing working as emergency medicine physician. I see this firsthand every time I go into the ED. We also consume a tremendous amount of energy. We have the longest commute of any city in the country. And so our emissions are elevated as a result of that. People spend far too much time in their cars. We're really rather disgruntled about it. Road rage is not uncommon. Unfortunately, I'm here to tell you that in a lot of ways, from an environmental health standpoint, there are more troubles ahead. I'm going to go over very briefly some of the mechanisms of climate change, and I trust, given where you all are coming from, that you have some sense of this already, so I'm not going to belabor the point. But basically, we've got a homeostatic model for the climate that includes radiation from the sun that forms the surface of the Earth. Some of that energy is re-radiated back up toward the atmosphere and then reflected back. And over history, that temperature regulation has been quite constant. But as we've changed the constitution of the atmosphere with greenhouse gases, we're radiating more of that energy back toward the surface of the Earth, and that's causing warming. I think the evidence is quite strong. It's in that this is really anthropogenic. It's of our own doing. You can look quite clearly back to the year 1000. The CO2 levels in the atmosphere have been pretty much constant. And they've, of late, taken a turn upward, to say the least. And this continues, even though we've had increasing attention on carbon dioxide levels around the world. We continue to emit more and more CO2 every day. So what is going to happen? Well, the best global circulation models tell us that we can expect higher temperatures as a result of this, a direct effect of this. And the range is anywhere from 1 to 6, depending on the model you cite. As we have moved forward from the last IPCC, Intergovernmental Panel on Climate Change report, we have more evidence about where we're going, and we're on track for these high projections. And also, the IPCC, the next report will state more clearly that the democracy of the models is coming to an end, and those models that tend to project the highest impacts are also the ones actually that seem to have the best historical fidelity. So, unfortunately, we're looking at the higher range of these projections. Anywhere probably between 3 and 6 degrees Celsius is a distinct possibility by the end of the century. Also, 2 to 3 feet of sea level rise. 2 feet probably is, I think, where we're headed over the next 100 years. That's a pretty dramatic, although it's not going to quite be lapping at the border of Ohio, but for the coastal dwellers in our country and elsewhere, it's a significant issue. There's also going to be changes on the hydrologic cycle, and that's the cycle in which water circulates in the atmosphere. Probably more extreme precipitation, but also more drought. So temperatures are already rising. We've seen evidence of this that started back in the 60s, and it's a fluctuating trend, but it's a clear trend. What's this going to mean? Well, it's going to mean that heat indices are going up. And again, it depends on the model what the actual projection will be, where we'll be. And heat index is not just the ambient temperature, it's humidity and other things that determine how it feels. But that's actually, from a health standpoint, what really matters. Not just how it feels, but in fact how it affects you physiologically. And here we see on the left is the Canadian model. It projects summertime temperatures upward of 115 degrees, the heat index, over a sustained period of time in the southeast and reaching up into Ohio. Other models are a little bit more conservative in their projections, but still, this is something that we deal with a heat index over 100 for a month at a time in Atlanta now, but we do it because everywhere you go is air conditioned. Every single place you find yourself in the summer has to be air conditioned. 115 degrees, we don't deal with that very often right now. Parts of Texas do and other areas, but we don't. The ice caps are melting. They're melting actually faster than we have modeled and expected. So clearly there's some error in our models, and it goes both ways. Sometimes we over project, sometimes we under project. But we are seeing a pretty clear trend of melting that's going to lead to an ice-free North Passage within our lifetimes, definitely. So we can see evidence of this all around the world. Almost all of the world's glaciers are retreating. And that was, if you go back there, 1941 in Glacier Bay National Park in Alaska. This is 2004.